think we all know well that the population in the world is increasing so sharply and nearly achieve 8 billion um, over words in the world, of area in the world, and 25% of them is the Muslim. So the global Muslim population is also increasing, and most of them will willing to fast during Ramadan fasting. We know that religion is a deeply personal matter, and fasting during holy months of Ramadan is important event of the Muslim. So all mostly of the Muslim will to do it and still to do, although they have some problem in the head. And although in the Quran also has prescribed that fasting is only for the Muslim who mature and healthy, but still the most Muslim people to do it for the full day of the Ramadan. And it's very, and maybe be promotes the development of unwanted problem. Why the Muslim still insist to fasting? There are many reasons for this that I think Prof. Nur Asmi already mentioned about the basic of the faith. And but I will show you some reference. Muslim is insist for fasting, although they have no, they feel unhealthy. When we are looking to the population-based study, big population-based study, APDR, CREATE, Darmena, and Global Survey, although Ramadan may promote some problem of the diabetic patients still, mostly of them, nearly 90% of type 2 diabetic and nearly 70% of the type 1 diabetic intend to fast with any reason. What about the perception of Ramadan among the diabetic patient? Molla et al. Stated that patients with complex medical condition, including diabetic, and in particular those who don't feel physically unwell, will often choose to fast, even medical and scholarly advice permit exemption. So that Molla stated this word based on finding on the study. It is in interest what stated by Lee, although this based on the only 53 participants, but this is a result of the qualitative study, deep qualitative study, and the results said that some participants mentioned that they were understood the challenge faced by Muslims who fast during Ramadan. Is it difficult for them due to the medicine regimen, complex medicine regimen, and long period of without food? But some of participants mentioned that they rely on their faith as the source of strength to overcome the challenge of fasting. And the other view that their current predicament was challenged from Allah, so they have to choose it. Another interest is what reported by Hanif. Although in the Quran stated that fasting is only for the healthy, but the majority of Muslim patients living with diabetic don't perceive themselves as sick, so they continue to the fast. maybe two kind of the report make us understand why people with diabetic still insist to fast. Now we are looking to the effect of Ramadan, safety or maybe benefit. Safety in the patient, in the diabetic patient fasting, safety patient in the diabetic patient reported by Penera et friend stated that Ramadan is significantly associated with decrease in blood lipid profile, blood pressure, glucose, and A1C. So fasting, they think, give some benefit to the patient. We are looking to the reportation by Dr. Hasanin in the Dar MENA. Also, that fasting Ramadan gives some benefit. We are looking on weight with circumference, systolic blood pressure, heart rate, A1C, fasting blood glucose, postprandial blood glucose, as well as LDL. And then in pregnancy, we have already heard from speaker before, effect of the Ramadan on the pregnancy. When this data reported by Glacier et al. That Ramadan fasting does not have adversely effect on birth weight, but not the other outcome. So I think we must know what is effect Ramadan on other outcome of the gestation pregnancy. This is the other report come from the Turin, also Nemiti, stated that Ramadan fast is not associated with any change in incidence of acute cardiovascular disease and give us improvement in coronary heart disease risk score, and other cardiovascular risk score. Also in decreasing weight, BMI, also with circumference. And reported, Malik also reported that in patient with diabetes stable CKD, the stable CKD on patient diabetes, patient still able to fast, but with close monitoring, but patient on HD and peritoneal dialysis is considered to high risk. Also, patient with the prominent proteinuria. It means that in stable CKD, fasting maybe still can do. But actually, we must remember that fasting is not safe for Ramadan. Again, based on MBTR, CREAT, and the other study. Then we know that there is incident of hypoglycemia during fasting that's ranging from 4.0% to 43%. It's quite a high number, the incident of hypo reported by Lee based on the qualitative study, deep observation in patient. So I think the difference is in the number of incident due to many factors like education, like complication of the patient, and the other. Then we know that all conditions must take care because the hypoglycemia event can be prevented by good education before going fasting. I mentioned before that the high incidence of hypo is reported by Lee. Maybe it's 2 lakhs of special Ramadan education. Because in the study, they found that self-adjustment of medication is due by patient itself, and no suggestion or advice from the medical staff. This is give us a special attention about the education, because education is not so easy to do. Let's say in Indonesia, we have a wide area, wide number of people with diabetes. It's nearly 20 million people with diabetes, and limitation of the healthcare professional, also educator. So we must maybe we must develop a simple model of education and implement it through the apps. Data from MBDA studies show to us that fasting itself promote the increasing evidence of hypoglycemia. It's nearly around 5 times in type 1 and 7.5 times in type 2. It means that fasting itself in around 30 days can promote some unwanted outcome. This is the data from the Avandi that already reported in 2018. In uncontrolled type 1 diabetes, proved by the high concentration of fasting based on the CGM. And then we can see that more than 50% of patients have complication hyper and hypo. So I think give us to alarm. In case of uncontrolled type 2, type 1 diabetes, we must have more attention to avoid the problem. Again, we see that the Darmena, the insulin and SU is the two kind of the medication that give increasing incidence of hypo, as well as we know well before. And this is a very interesting data that the score of race, grade score, risk score of the IgA in this study is very closely related to the outcome. Low race score give only few incident of hypo, but in the very high risk, and then incident is increasing 3 times higher. Also, the episode of hypoglycemia before Ramadan also contributed to the increasing incidence of the hypoglycemia during Ramadan. I already mentioned before that ESU and insulin promote increasing of incidence of hypo. If we are looking this risk score that already published, the new guideline score by IDF, we can see that many elements already put in this calculation. Diabetes type, duration, SLE, fasting hours, and then categorized to 3 groups: low risk, moderate risk, and high risk. As we reported before, that this risk score is very close to the development of the hypo. So I think health professional must know well, understand and know well, and familiar with the score to implement before someone going to Ramadan. And as a summary, I would like to say that Muslim patient with diabetes have an optimistic look when deciding to fast or not to fast. Some diabetic patients accompanied with several health problems that may make unsafe still willing to do Ramadan fasting. And the risk score scale is very important tool for estimating risk outcome and can be used for business making decision fast or to fast or not to fast. It means that all health professional should understand and familiar with the use of this score. Specific Ramadan education for diabetic patient should to do to ensure safe fasting during Ramadan. Healthcare professionals need to understand why those DM patients continue to do fast and make collaboration with the religious community as well as community leaders to reach out and educate the patient. Thank you very much.